And we've put together a really interesting panel of people to discuss a topic which is, I think, really hot in healthcare, and that's around engaged patients and how technology will help and how technology hinders engaging with patients. And so I'm excited to have an amazing group of thought leaders in the healthcare IT industry. So let's just go around the room, I guess around the online hangout, and we can introduce ourselves. I'll start. So I'm John Lynn, the founder of HealthcareScene.com, a network of 10 healthcare IT blogs. We also have a healthcare IT career website at healthcareitcentral.com. And I also run the Health IT Marketing and PR Conference at healthitmarketingconference.com. So I've been blogging for about 10 years, well, we've published on our network about 9,000 blog posts and had, I think, somewhere around 16 million page views. So we've written a lot of healthcare IT content. I like to say I live, breathe, eat, sleep healthcare IT. So there's a little bit about me. Chuck, do you want to go next?
Just call me Dr. Wareflow, because other people do. I'm my background in medicine, industrial engineering, artificial intelligence, and I was a pre-med accounting major from the number one accounting school, University of Illinois, go Illinois. And I blog a lot, not as much as you. In fact, I've learned a lot from watching John, who can write a 1,000-word blog post in a couple of hours, and it is grammatically perfect, and he swears he doesn't run it through a spelling or grammar checker. And I tweet prolifically. I'm at Wareflow, W-A-R-E-F-L-O, no W at the end. Wareflow, and Wareflow, software workflow. I'm interested in software workflow in healthcare, all aspects of it. And obviously, John is thinking, Chuck is really going to do what Dr. Nick threatened to do, but I'm not. I'm going to shut up.
Well, actually, I was just wondering how long the over and under on how long it would take you to stay workflow would be, but I'm glad you got it in there because that's only appropriate. Chuck is the preeminent workflow addict, so thanks for joining us. All right, Colin, you want to go next?
Sure. Hopefully everyone can hear me.
Yep.
So, hi, my name's Colin. I'm a healthcare IT and healthcare marketing person based out of here in Toronto. So one of the two foreigners on the chat today. I blog a little bit. I am also the co-founder of HCLDR. That's the hashtag we use for a weekly tweet chat that we run that talks about healthcare leadership issues, health IT issues. I love healthcare IT. It's my chosen profession. I've spent the last 15 years in healthcare IT with a variety of entrepreneurial companies. The company I work for right now is Stericycle. They're mostly known as a healthcare waste management company, but we also have a division that I'm part of that is into technology and communication and patient interaction. And so I'm looking forward to today's chat. I've always looked forward to any kind of opportunity to talk about healthcare IT and with very smart people on the chat as well. So looking forward to today.
Thanks, Colin. Welcome. Glad to have you here, and I love your insights. I know you take a real research perspective, so I love that about your approach. Dr. Nick, do you want to go next?
Thanks, John. Appreciate it. Excited to be here. My name's Dr. Nick, DRNIC1 on Twitter. I'm the Chief Medical Officer for Dell, and I come to you from a regular office, unlike Wareflow, who's obviously on the set of Star Trek in the virtual reality simulator. I'm focused very much on the innovations in healthcare technology, very passionate about wearables. I'm like everybody else on this call. I have patients as well as relatives, friends who use a system that is very challenged and believe that this area, this topic, as you rightly described, John, is central to everything that we need to be focused on to help fix some of the underlying problems in healthcare. So excited to be here. Thanks very much for the opportunity.
Excellent. Glad to have you all here, and looking forward to engaging discussion. So let's start off with kind of an intro to the topic, and what does patient engagement mean here in 2015? And maybe even a related question: does it really have any meaning in 2015, or have we corrupted it to the point that it no longer has much meaning? Dr. Nick, you want to take that one?
Absolutely. I'm trying to be the good citizen, so I'm muting and unmuting, and I had to unmute myself. So, it's interesting you bring that up because that was the topic of a recent tweet chat that was asking that very same question. Are we still sort of, is patient engagement the right term? I believe it is. I mean, I think we're still trying to move a historical group of folks who see this paternalistic distribution of medicine. I just recently had a discussion with one of my relatives who's visiting, who described their interaction with the doctor, and they weren't terribly satisfied, but didn't want to challenge it because that wasn't the thing that was done. And I think one of the things that patient engagement really starts to change is that interaction is no longer this distribution of knowledge like the Wizard of Oz. It's much more a cooperative engagement between the patient, their family and friends, as well as the physician and all the ancillary workers. So I believe it's still a relevant term and appropriate, and one that we need to sort of help people get towards because they're not there yet. Whilst I think everybody on this call probably is, I think not everybody else is.
Huh. Interesting. I bet Colin has a different perspective, since I think you come from more of a business perspective on how to engage the patient as well. What are your thoughts?
Well, I mean, I think patient engagement, unfortunately, in the last year has become a really overused and now even more amorphous term than when it started. I think now I use patient engagement now as a blanket term to refer to a whole bunch of methodologies, approaches, technologies to work with a patient. So what I mean by that is, I think, for example, lumped under patient engagement are patient interactions, different ways to interact with a patient, whether that's through portal or texting technologies. I think there's patient health literacy involved, kind of lumped under here, because in order to actually interact with a patient or engage a patient in their care, they have to understand the nomenclature that's used in medicine. And then we get all the way through to some of these more fancier tools that we've now got and capabilities. So I think patient engagement has just become an amorphous term. I think it's okay to use it. I just don't think it has a very specific definition like maybe it once did. So that's my personal opinion on that one.
Yeah, and I would add that meaningful use has corrupted it even more, because meaningful use required what it called patient engagement, which was one patient downloading one record from your organization. And so I think, many organizations have taken that and said, okay, well, I engage with patients. I've had one patient download one record from my portal, which I think ruined the word in many respects as well. Chuck, how about you hop in? Anything to add to that? And also, let's extend the conversation, because it's great to talk about patient engagement, but why should healthcare organizations care about it? What should, it's nice to talk about, let's engage the patient, but who cares? What are the real reasons that they should versus, that it just seems like the in vogue thing to do?
Well, I'm basically an engineer, and I build systems. And so I went out and I looked at some of the definitions, and they were just kind of all over the place. And I have a very simple, perhaps simplistic definition of patient experience and patient engagement. Patient experience is everything that happens to the patient. Patient engagement is everything they do back in response. But contrast that with my wife. My wife is a customer service expert, does a lot of training in that area. I asked, especially in healthcare, and she defined patient engagement as everything that would lead a patient to recommend your organization's goods and services, which I think is a rather remarkable consumer-oriented sort of thing. So that's very different from my definition. So I agree with you. I think the definitions are all over the place. And I think one chooses a working definition that's most useful for your particular purpose.
Interesting. And what are the impacts if you don't engage a patient, do you think? I mean, especially in the future of health?
Well, this shows you that, again, the difference between someone who builds software and my wife, who is kind of comes from the hotel and hospitality industry, where you get to choose between hotels. So from my point of view, they don't click on the thing I want them to click on. which is a very micro sort of view of the world. And her point of view is if you don't do patient engagement right, you will go out of business because they will take their business elsewhere. Different views.
Yeah, so I think the marketing aspect is an important one, right? You know, if you want to market yourself to a patient, I wonder if we will be willing to go to a doctor's office that doesn't engage us in the future. Almost like, I mean, I like the online banking analogy. You know, could you imagine going to a bank that didn't have online banking? For a while, you chose it on that. You know, when we start choosing our provider based on how well they engage us, what ways they engage us. I think that's going to be interesting to see. Anything else you'd add, Dr. Nick?
You know, I think that train has left the station. If you're not engaging with your patients are going to go elsewhere. We've seen a massive shift of cost, and there's nothing that focuses the mind of patients more acutely than being personally responsible for individual costs associated with their care. Everything down to drugs. Look at the enormous focus today on how high the prices are in this country, the United States, relative to other countries. Colin can probably talk about how cheap his drugs are in Canada because people try and access them, and you know there's all this protectionist behavior. But why has that become such a pertinent issue? Because suddenly people are aware with these high deductible plans. So everything is being shifted, and as a result, people are being held responsible for the spend that historically they didn't. And by the way, that effect is magnified, interestingly. I think this is a forgotten issue around this, because once I've made my commitment based on my personalized individual spend, anything that follows on, perhaps the expensive hospital treatment that's fully covered, I'm going to stay with wherever I came. So the effect of this is going to be much bigger on these providers, even if they say, well, it's just drugs, I don't care about it. So I think that train has left, and people are absolutely jumping on to understand and get engaged. And if you are not participating, you're not seeing or hearing any of this, you're missing out.
So you're going to lose patients. I guess that would be one option, that if you're not engaged, you argue that it's already happening, you're losing patients. What I think is true with high deductible plans. You know, do you think in the ACO world, the value-based reimbursement world, that this patient engagement is going to be important? Colin, looks like you have something interesting.
I was just going to make I'll make a point on that, but I wanted to just comment on something that Dr. Nick said. I think, you know, one of the things that certainly we talk about a lot in our business is, you know, patient engagement for a provider can be very daunting because it is so amorphous, right? You know, you say patient engagement, you say you should be involved. I agree with Dr. Nick that if you're not involved already or not thinking about it, you've kind of missed the train. But it can be a lot simpler than that. I think, you know, to me, engagement starts with communication, and unfortunately, there's a huge gap in that, even that very basic fundamental step of just being able to communicate with your patients in a way that they want to be communicated with, whether that's by phone, via email, via Facebook posts or Facebook messages. We just don't do a good enough job even of that. And until we are able to communicate in the medium and then using the terminology that someone can understand, I think all this other stuff is just noise. And so, you know, when we talk about patient engagement, or when I talk about it with clients and with people I meet at conferences, I'm very focused on the communication angle, just because I don't think we're doing even that very well. And so when you bring that to an ACO and you bring that to other organizations, I think they can start very simply to get involved and to start that just by going, hey, let's just figure out, let's not even go to portal yet. Let's just talk about how do we talk to our patients. And let's get that kind of ironed out a little bit first and understand what they want there before we get into some of these more sophisticated tools and approaches that, you know, are unfortunately flooding into the market right now.
So let's extend that conversation then. You know, I think you're right. Doctors are overwhelmed with options. that are available to them. I mean, there's so many people that are shouting patient engagement from their pulpit. So, what are some of the companies and products that you've seen that really engage the patient? And how can we help out these doctors and hospital organizations that are looking and saying, what's really working? I'll start with one that I think is powerful and it's really gaining traction is the secure text message market. And there's a lot of players in that space, but I think secure text messaging and kind of accepting that, hey, many people want to text with their doctor, with their healthcare organization, and that actually can save an organization and a provider time, because then you're not dealing with this ongoing battle that we know that's called phone tag. If you're able to just text to them and reply and you know that they got it versus the hours that you spent trying to get them on a phone because no one answers their phone anymore, I think that's a powerful thing. What are some of the other tools? Who's got some interesting tools they could share or platforms? Charles, you want to go?
Thank you. And I'm on. Okay. First of all, I'd like to say that what you were talking about, that structured secure text messaging, is in fact workflow. It's workflow technology. It's being extended out. It's to-do lists that are asynchronously, they escalate if they're not being answered. You can track them. There's workflow analytics. Some of the consumer and patient-facing systems that are coming onto the market have some of the most sophisticated workflow technology under the hood. But second thing is, I'm kind of intrigued. There's a company in Boston called, I think it's called Kyrus, K-Y-R-U-U-S. And what they do is they use machine learning and big data, and they match patients to physicians. And it reminds me of, in my wife's case, when she does a lot of employee training, she says, the beginning of employee training is choosing the right employee. And so much of the quality of the patient experience, and then of course a good patient experience is kind of a prerequisite to then engagement, is the match between the clinician and the patient. And then that, of course, that leads on to scheduling and then appointment reminders and the kind of structured text messaging that you're talking about.
Excellent. Dr. Nick looked like he had some ideas. What do you think?
So I want to pick up on something that Colin said. I think he's right. Start out with some of the basics. I think that's a really important point, and I would just add to his point around the understanding of the content. Currently, people can't see. It's a struggle. You walk around with the Office of the National Coordinator's memo to say, "Give me my damn record," as e-patient Dave would say. I mean, even today, I still have that problem. So I think people have to get it first before we start to deal with the translation and putting it into real terms. And again, I think that will be driven by the customers or the users in all of this. But from an example standpoint, I go all the way over to another side of the world and go to Africa, where they've been doing this stuff for a long time. And really effectively and really simply, too. They just use text messaging because they're bandwidth limited. They've got some real challenges, with available bandwidth. And they've done simple stuff. I'll give you a couple of examples. Just texting somebody to remind them to take their HIV medication at the appropriate times actually improves overall compliance and decreases incidence of HIV and, the sequelae associated with that disease. Simple stuff that, it's contextual and it's understanding. And, to Chuck's point, that contextual piece of information that says, hey, I know on a GPS standpoint you're here, allows you to start to infer when to send that message out or to interact with your customers. Again, understanding their social media habits. I bet everybody on this call and listening in has different habits to the way that they interact with all these media. If you understand that and then interact on Facebook or Twitter or whatever the channel is, you can improve the interaction and make it in an interaction versus a sort of store and forward. And then the other example would be, the aspect of obstetric care in Africa, where distributing ultrasounds into remote places and having people capture an ultrasound, sending it for reading, and then importantly sending back a text message that says, safe or not safe. You know, simple binary, but huge reduction in both maternal and fetal mortality. Because if you know that it's an at-risk pregnancy, you're going to take the walk, or however you happen to get to the hospital that's either 24 hours or maybe 3 days away. But if you know that it's potentially or likely to be a safe pregnancy and delivery, then you'll do that locally. These are simple things. We can learn so much from other countries. I know we've got all this great tech, but we can do simple stuff here first.
So do you think the problem of adoption in the U.S. is really just the culture? I mean, we have the solutions, we have the options, but we need to change the culture, like you said, of, you know, being okay to give up the data, being okay to send a text message to, you know, and maybe I guess the reimbursement environment, they don't pay them to send that text, you know, so that maybe there's some issues there too, or is it something bigger than just, you know?
I think that's partly it. It's you know, culturally and, you know, some age related, although, hey, I find my 87-year-old mother, my 83-year-old mother-in-law using text messaging. I mean, I was sat in the room with her and we were having a conversation. She whipped out her iPad and she's looking up stuff on Google. So I don't think it's generational. But the bigger part to that is reimbursement and regulations, and, you know, the security associated with text messaging. The problem with that is that it's not secure and therefore, you know, non-patient. I think you can find methods around that to still comply with regulations and satisfy people's needs without exposing information effectively.
Colin looks like he's itching to share.
Yeah, again, I don't want to sound like an echo chamber here, but I totally think that the two factors that Dr. Nick just mentioned loom very large in the U.S. and the Canadian market. One is the reimbursement issue. I just think people aren't reimbursed for the time they spend on these asynchronous tools, where, you know, like texting, like emailing. We're starting to see that change with telemedicine, which is sort of the technology that I would have mentioned in terms of engaging. I think that's changing now. People are recognizing, hey, like, it's all right to pay doctors for after hours and using these other tools now. So I think that's going to change over time. I think that was probably one of the biggest reasons why it wasn't done. But I think we use privacy and HIPAA and other regulations like that as an excuse as to it's too complicated, so I won't touch it, right? Because if I share anything online, if I share anything via, you know, other than fax or this other or old school tools like phone, it must be violating HIPAA, right? And I think there's this sort of blanket cultural assumption that we just can't share health data in anything but something that was approved by government, which is in fact not the case, right? So I do think there's some cultural things we can do to kind of change the attitude towards privacy. We shouldn't use privacy as a barrier to health. That's not the point of HIPAA and not the point of those regulations. So I do think there's a bit of a culture change that we need to start to get to, which, you know, the good thing in those other countries is they don't have, you know, bad news, they don't have the privacy legislation, but the good news is they haven't let that, because they don't have it, they haven't let it stand in the way of what really the ultimate goal is, which is to get people engaged and get people healthy.
Well, and far too often I see people invoke the name of HIPAA as an excuse not to do something, not because they actually care about the privacy of the information, but really just as an excuse that, oh, I don't want to do that, you know, because it changes my workflow, it changes my life, it changes my the way I work. So I think you're absolutely right. You know, how do we get around that? I mean, is it just an education thing, or you know, do patients need to start just demanding and saying, hey, there's something in HIPAA called consent, and I say it's okay, so go at it. So yeah, I don't know. You bring up an interesting point with telemedicine. I just have seen a couple announcements. Modernizing Medicine announced, they called it a telemedicine implementation, which was really an image implementation, image sharing, which made sense in the dermatology space where they could share images with their doctor across it, which I think it was interesting that they called image sharing telemedicine. Athena Health just announced an integration with a telemedicine company through their More Disruption Please marketplace. So they're integrating telemedicine into their platform, and as part of that announcement that I thought was really interesting, and I forget the company offhand that did it with them, I apologize to them, but the really interesting thing is they actually created an engine that would actually go in and say, will this telemedicine visit be reimbursed? So it goes back to the whole point. No one wants to do telemedicine, or no doctor does, because they're afraid they're not going to get paid and it's just going to be a free visit, or what's the business model? So this company built an engine that allowed people that did telemedicine through their platform. It looks like it's a Chiron Health, Chiron Health Partners. Anyway, they built this engine that would say, we're going to go see if you can get paid for this telemedicine visit, and I believe they even have a guarantee, which makes sense since they're working with Athena Health that loves doing the guarantees, that if you didn't get paid for it, they would pay you for it. That's how much trust they have in their engine, I guess, that they get paid. So I thought that was an interesting extension, and okay, well, we want people to do telemedicine. How do we do that? Well, let's create an engine that lets them know that they can actually get paid for it, and then they might actually start doing it. Any other tools or thoughts on patient engagement, or maybe are there some areas you'd love to see more patient engagement that you're not seeing it? Dr. Nick?
So I think that's a great pathway through finding a guarantee. I'll tell you, again, the consumer and, follow the money. And as you become more responsible for your own care, I think that drives, behavior. And there's a harsh reality with telemedicine. Thousands, hundreds of thousands, millions of mothers and parents around the country who have kids who have minor illnesses, minor infections, minor issues that they have to take time off work, get in the car, go to the physician's office, wait in the office with, just unattractive environments, all the risks associated with that for a 5-minute visit, and then have to go to the pharmacy. And currently, I can tell you my health insurance, that's roughly $135 experience for $40. So for less money, I can have a visual, interaction, FaceTime-like through HealthTap for one of them, I'll pick one. I'd rather pay the money. And I think increasing numbers of people are going to vote with their own pocketbook because they're paying with it anyway. And if the insurance companies follow suit and start reimbursing, then all the better. But I think people are going to drive this. Consumers are the big marketplace.
So what areas do you think are not being engaged right now that you think are potential opportunities for either doctors to engage in a new way, or possibly even entrepreneurs? Any thoughts there? What's missing? Chuck?
Sorry, you broke your initial point there broke up, so I missed it, I'm afraid.
Okay, so the question is, what's missing from the patient engagement market right now?
In terms of technology?
Yeah, in technology, yeah, I would say. Is there any opportunities that someone hasn't captured yet?
Well, I think an awful lot of the existing infrastructure and technology is there. It takes a simplistic, I'll approaching this from an ease of use and a simplicity, methodology that says, I'll make this as easy as possible so that it's not, this Google Hangout's a good example. I remember doing this a couple of years ago with you. It wasn't as smooth, it wasn't as easy, but we've ironed all of that out. It seemed to work very well. I just used a URL. Same kind of thing with healthcare. Tying this all together into a package that says, perhaps your doctor just sends you a URL that you click on, and this stuff all works. We could have an interaction. I could look at you, and we could go through a patient interaction. So I think simplifying what's already out there into a package that people can use quickly and efficiently is going to be key.
No, it has come a long way. I think the first hangout we did, we spent about an hour going through tech challenges. So
Exactly.
it's the evolution of technology, and I guess that's the sad part is that we're at the beginning of the technology implementation for healthcare to get patient engagement. So we still have to go through the learning. Interesting.
Right, and you know, in fairness to Chuck, I would say that's that's his mantra. He's always beating on this. It's another way of sort of thinking about this is workflow. How do you improve that whole process? And that's rightly so. I mean, there's a reason that he keeps popping up everywhere because he's always here. He goes. He's going to show you. It's all about workflow.
So let's hit that, Chuck.
Okay.
Tell us about workflow.
Okay, I have charts. This is like Ross Perot, running for president, if you can remember that. Okay, so you got the patient over here, you have the healthcare system over here, and experience is what happens to the patient, and engagement is what the patient does back. Okay, that's fine as far as that goes. But the healthcare system, full of clinicians and administrators and so forth, they are interacting with this technology. And this technology distracts them and pisses them off. And the hotel industry has a wonderful phrase, which is the system behind the smiles. So when someone greets you at the curb and you get checked in and everything runs smoothly, first of all, there's a lot of things happening in the background that those employees can just count on and know will work. And that frees them up to sort of live their organizational, cultural ideal. But at the same time that this is happening, there's new workflows being created between the patients and the technology. This is the self-service stuff that's going on. Well, when this happens, this also frees up the clinicians and folks to do what they do best because you're automating these workflows. So what really ties this all together is the big W in the middle. That's the workflow. So that's my workflow chalk talk.
That's great. I mean, I think it's good. I'm glad you brought up some interesting points because so far we've said technology is great, patient engagement's great, we need to implement it, but let's throw a little realism here, right? I think if I'm a doctor, which I'm not, we do have two doctors on, which is great. If I'm a doctor and I'm making the arguments, which I see on my blog all the time, many of them make the argument that says patient engagement is awful, it's hard for me, and let's take it even farther, technology is awful, and I don't want anything to do with technology because it's getting in between me and the patient and it's causing me not to engage in the patient. What are your thoughts on that as far as, EHRs in particular, how they hinder patients? What's in your experience and how do we remedy some of those challenges that doctors face? Chuck, do you want to take that?
Sure. I will. My reaction is, and I'll speak specifically about the electronic health record, is that folks view electronic health records as almost as commodities these days, and to some extent, meaningful use has sort of created a lot of similar EHRs. However, one doc using one EHR can absolutely love it, and another one not. And also different EHRs have completely different user interfaces. Some are speech recognition driven, some are big buttons and they're really simple to use, and some are very customizable in terms of screen flow and so forth. And so I think the Luddites are misunderstood. The Luddites weren't anti-technology. They were anti-losing their jobs because the technology was so good it was putting them out of work. And that's not what's happening with electronic health records. Electronic health records are creating more work for physicians in many cases. But I don't want to tar all of them. I think there's 10 or 20% of electronic health records out there that are really have either survive meaningful use in terms of some of their unique usability characteristics, or some of them just say basically, I won't participate.
Interesting. I think you're right. I think there are good ones, and to me the biggest complaint, they're like, yeah, the computer's in between me and the patient, and I think that some of the solutions I've seen around that, as far as engaging the patient, I mean, now we're going literally into the exam room, is, the ones that literally hook up a cable and project what they're doing on the EHR right onto a big screen.
Like Jimmy Vanagan, if he's watching right now, Jimmy Vanagan, and that brings us to Periscope. We should talk about Periscope.
Oh, Periscope. Yeah, you had to go there. We'll get there. We'll get there at the end about social media. And Jimmy's actually looking for the right link, so I just sent him the proper link on at EHR and HIT, if so people can join in. But yeah, I mean, it's a powerful thing. They do it in my office too with Zubin Damanya's Turntable Health. They literally plug in and they want you to see what's going on, and I think that changes that dynamic, because then you're not like, oh, they're playing Angry Birds. You're like, yeah, they're documenting what I just told them, or they're looking up a drug, so that they can tell me what drug that they want to give me. So my favorite comment though about all of that though, where a doctor complains it's in the way between me and the patient, and my the best answer I've ever heard was, well, just leave the computer. Like, the computer's not requiring you to be next to it, right? You can set it aside. You can go to the patient. You can sit down. You can talk with them. I think some women might argue, well, I don't get paid enough to do that, and there's some arguments for reimbursement there. But when you look at it, for the most part, it's certainly a challenge. But you have a choice. It's kind of like if you have your cell phone on your pocket in vacation. You have a choice. Do you want to answer that cell phone on vacation or not? Anyway, Colin, any thoughts on the way technology hinders us, and how do we battle that?
Yeah, I mean, I think it does hinder us. I think we've done a poor job at building EHRs that can be used in front of patients. I think what we've done in the first gen and even the second gen EHRs is build something that is aimed at doctors, right? That's aimed at clinicians to use it. It's not meant to be, the screen is not meant to be turned around, so to speak, and shown to a patient, because it'll probably scare them with all the fields on it and the way that things are laid out. But I think now the new crop of EHRs and the smart ones are realizing that what Jimmy Vanagan is doing and what other physicians are doing is actually going to become the norm, where we will be looking at the screen together and looking at decision support tools together and say, okay, based on the symptoms you gave to me and you're telling me, I kind of entered it into this wonderful algorithm I've got, Dr. Watson or whatever it is, and by the way, it's coming back with these, and so let's work together to eliminate what it might not be, and get together to a diagnosis or get together to a treatment plan. I think most doctors most good doctors did this before the advent of EHRs. I think the technology got in the way because now they were just so focused on entering data properly, and I'm hoping now with some of the new crop and new features of some of the EHRs that are coming out now, they've gone back to, okay, like realizing it is a collaborative effort and we should build some things so that it can be shared. And so I think there is a trend towards that, and I think doctors like Jimmy and others are pushing the industry there. I just don't think there's enough critical mass yet. But I just think in the rush to meet the meaningful use dollars, in the rush to digitize everything, we kind of just went with some of the basics, and now we're finally getting into where I think is going to be truly helpful for patients and for clinicians.
It's interesting. I mean, there are so many solutions out there. I'm torn on the challenges associated with it, because one, I know that doctors and practices, hospitals, they've been distracted by meaningful use. I mean, they're just so busy with meaningful use. But on the other end of things, doctors are also faced with what I would call the paradox of choice, right? That they have so many choices that they aren't sure what to choose, and so they kind of choose nothing. Which I think is one of the challenges many doctors do. It's like, well, I'm so busy seeing patients, I'm so busy dealing with the realities of my practice. Which of these solutions is best, and how do I implement them? Oh yeah, and I've got to deal with meaningful use, and hundreds of requirements there, and do I even do meaningful use stage 3, and that's going to be even more complex. Which I think maybe the biggest challenge of all is that paradox of choice that I mean, even EHR vendors, there's 300 of them, right? So it took them forever to just decide, and it took $36 billion of stimulus money to get them off the fence and say go for it, right? Anything else to add, Dr. Nick, to this?
So I think Chuck makes a great point about this Luddite issue of, they're not going because they're Luddites, and that's not true. It's because it's interfering. But I would also push back a little bit on this concept of, I don't want to use it, technology's bad, and challenge these folks and, watch them in their every day-to-day interaction. And you can almost guarantee that the vast majority of these folks, they'll leave the house without their wallet, they'll leave the house without their, wife and children or husband, but they'll never leave the house without their mobile phone. And, that's because it's a useful device, it provides utility, and it's doing so many things for us now. That we didn't even imagine. And, to Chuck's point, it's because it's not been placed in a means that actually delivers value. It's why am I recording blood pressure as a physician? You don't find the CEO of Bank of America entering stock prices, but, we still ask physicians to do tasks that don't make sense and use an interface that doesn't make sense. So some of that's design, and I think you're right. You've got this massive selection and, simplifying that, again, principle of simplification. The problem is that when you put 5 physicians in a room, you'll get 7 different responses as to how to treat a condition or do a particular task. And it's imposing a little bit of structure and discipline on that says, do you really need to? And I'll pick on, so I used to work for Nuance. I'm a big fan of speech recognition, and I can't tell you the number of times that I would go into a demonstration room and I demonstrate speech recognition, which, quite frankly, it just works. It's phenomenal technology. It just really works well. But the first question and the first, pushback would be, well, let me try it. And they would try and break it. They'll find some methodology to try and break the system and dictate something that was difficult or obscure, and is it perfect? No. Is it good enough? Absolutely. And I think that's true with technology, but we have to start limiting and simplifying and creating an infrastructure that's a little bit more controlled so that we don't have all of these variations on a theme, the 300 choices, so that you get effective use and people get value. And if it needs to be on a small device, put it on a small device. If it needs to be on a larger one. So I think there's a number of factors in there, but simplification and a little bit of oversight and control that says, yes, you're all individuals, a la Monty Python, but no, you're not all individuals.
That's great. Good insights. And I think that is the key to any implementation, is to simplify it down. What do we really want to accomplish? What's the goal here, and how can we use technology to accomplish that? And is technology the right solution? I mean, I loved when implementing EHR. There were many times where we looked at it, we said, could we do this with EHR? And the answer was yes. And the next question we asked is, should we? And sometimes the answer was no. Sometimes it was easier to just have a little half sheet of paper that we solved something with, So, patient engagement doesn't have to be technology. I mean, it's great to push engagement education solutions to the mobile phone or to their email or to their text. But sometimes for some patients, it's much better to hand them a little piece of paper and sit down with them and circle the 3 things you want them to read when they get home, and then they take it home and they read those 3 things. I mean, sometimes it's not always technology. Technology is a great solution. I think technology, for me, my core value is that technology can improve processes, but it's not always the best way. So let's, for this last 15, 20 minutes that we have left, let's talk about engagement with patients through social media. And maybe we'll throw it over to Chuck to talk about Periscope and Meerkat and some of those new social media solutions, and how can they be used, and I mean, is that the right way to use? Are there situations that doctors really shouldn't be on Periscope? Chuck, let's throw out the Periscope chat. You're on mute, Chuck. You gotta flip it off. I can't believe you're not periscoping this live.
I was tempted. I don't want to be disruptive in that unnecessarily.
You don't want to Periscope, your Google Hangout while doing it.
I was tempted. But I didn't want. If things went wrong, I didn't want to be the guy that got blamed. Well, first of all, setting aside the issues of security and privacy, which are just massive, and I'm sure that you and Colin and Dr. Nick can talk about should you friend someone reciprocally on Facebook and so forth. But what I'm fascinated by in the live video streaming area is the motto for Periscope is something like what's it like to be in someone else's shoes? Okay, that's like the tagline. Well, that's the definition of empathy. Okay, and so and again, I understand the privacy and security issues, but I think of someone these disease-based communities. Okay, someone walking in and they start periscoping and they say, I'm about to get a diagnosis that I'm frightened about. I mean, they will get 100, 500 people on there who are like rooting for them to offer them help. Now, maybe it needs to be more like a social intranet as opposed to just the wild and woolly world. But we're seeing an explosion. I mean, there's Blab and Meerkat and Periscope. I think within a couple of years you're going to see there's going to be kind of a spectrum of these video streaming systems, and I think it's going to be a very interesting. And then I'll just mention, of course, Jimmy again, who actually interviewed one of his patients about his EHR workflow. So I think there's some ways to leverage live streaming in that regard. Now, Twitter, Facebook, that's old hat.
Yeah, we don't want to talk about Twitter and Facebook. Well, although, interestingly, for most doctors, I think it's new hat. But, it's interesting you brought up the Periscope. I mean, you almost defined Periscope as patients like me on Periscope, right? And patients engaging patients as opposed to other healthcare providers. Colin, it looked like you wanted to chime in.
Yeah, and I think, kind of just building on what Chuck just said, those new tools are fantastic. I've watched Chuck, actually, I have to admit, I watched Chuck touring around his hometown and I've enjoyed it. But I think where I'm very excited about some of these technologies is less so in the public social media, but more the walled garden social media sites that are out there for doctors to collaborate, for clinicians to collaborate, for researchers to collaborate. I can imagine a Periscope for doing an experiment. If you're in a lab, in a bio lab, and someone was doing something, what a great way to share a real live science experiment with your peers. Or if you're a member of a health team, using a tool like Blab or something like it to confer with one another in real time to discuss a patient or a particular approach to treating a patient. I'm excited about where these tools can go in a private world. In a public sense, would I want someone periscoping a surgery? Obviously, there's a lot of privacy considerations for that, not to mention the graphic nature of some of those surgeries and things. So I think that may be a big turnoff actually for some clinicians to use it. But I think when you take these tools and these approaches and put them into something that can help people collaborate, I think that could be phenomenal.
That's great. No, I think there's two sides. What are the uses of this and the benefits of various social media? And the second is, how do you make the time to actually do it? Dr. Nick, any thoughts?
So I'm going to push back a little bit. I can see potential maybe in the future. I think what we don't know is what we don't know around this stuff. Are we going to look back in 20 years and think that the medical record in paper form or in digitized form as words is so quaint, and we record video and create value from that. I don't have a good vision of where that might go. My problem with Periscope in particular, and I think it has value in certain instances, is that it's a one-way system. I'm not seeing, Chuck talked about the patient going in for difficult news, but how am I getting support if I'm just sort of periscoping, unless I'm sort of going back afterwards and looking at it? It's not interactive. This is interactive, and look at how challenging this is with you know, 4 of us talking, and we've got to mute our phones or our systems so that we don't sort of override and take control. And there's, you know, there's more to it to sort of make this an effective media. That's
I've got to jump in there.
No, not to discount it, Chuck, because you're not allowed to do that.
But this is interactive.
That's true. I'm teasing, of course.
Okay, and now I mostly use Periscope for just fun, personal stuff. I mean, because I live in DC, I go to walk around, give a tour. I had I think about 1,000 live viewers. I watched the sunrise from Lincoln Memorial, and it was very interactive. I mean, I actually have the video. And you know, they were like commenting like crazy. They were. I'm so dumb. I think I'm a history buff. I walked through the Korean War Memorial and I misspoke, and I said, "Well, I think this is the." Someone asked a question because I'm reading all this stuff. So the comments are scrolling by, the hearts are there, so it's extremely interactive.
Fair enough, but one of the complaints of physicians is, hey, all this technology is distracting, and what you go in to see is you interacting with the physician, and suddenly you've got the screen and the patient looking at their screen. I don't think that this is quite resolved out. So can we display it in a way that's not intrusive? I'm not as I'm a big geek. Just follow this stuff, see value. This is still a little bit of a jump for me in terms of the value in that interaction. That when I go and see my physician, I want that, and maybe I'm unique in that because I have a clinical background, so I'm looking for a different exchange.
Definitely edgy
what
stuff.
Happens when the suicide patient gets on Periscope and tries to find some support, right? Because they're considering suicide. They hop on Periscope, and what they find is no one joins. So now you actually just made their condition worse because now they say, yeah, I was right. Nobody really does care about it.
Or worse. It's a double-edged sword. So yes, it's edgy stuff. Yeah.
Although I think video is really interesting, I recently, in fact, actually, I wrote about this. What about a video EHR? I wrote a video EHR idea about 8-9 years ago, and now it's nearly possible. I mean, if you think about it, what would be the perfect way for a doctor to engage the patient? Well, if they didn't have to document anything because it was all recorded live on video in a system, obviously it needs to be private and there's all the privacy concerns there, but if the entire visit was recorded on video and stored in the EHR, they wouldn't have to touch a thing, and they wouldn't need to, the full visit was done completely on video, and so no one had to ask any questions about what was done because they'd see the video if there were any issues. And then people say, well, what about the granular data? Well, and Nick is the expert in natural language processing and NLP and understands that world. It's like, well, let's take that audio stream, let's do the voice recognition on it. We apply the natural language processing so that when I say, yeah, I need you to take amoxicillin 500 milligrams twice daily, it's like you've just captured it all straight from the video, and that would be the ideal doctor system, right? You walk into the exam room, you see the patient, you engage with them in the best way possible, it's all recorded, and the EHR just happens, the documentation just happens, the billing just happens. And are we scared of that? I think Dr. Nick has something to say, but I'd just end on this point. Okay, well, we're scared of recording all these visits, but what happens in a telemedicine visit? I hop on a video, and the video is captured of me and the doctor talking. It's not that far-fetched, right?
No, not at all. Not at all, John. I think, that's my point about, at some point, maybe it's not even 20 years. I think that's potentially the future. You're right. Our capacity to extract useful knowledge, medical intelligence from that exchange interaction is on an exponential curve up. We can do it now pretty effectively. We're doing it even more so. Colin mentioned Watson. There's a number of these systems that are sort of approaching that. And there's even the case to be made that why are we structuring this? We're structuring it because we need structure to be able to report on it, because we don't have the artificial intelligence, for want of a term, I don't think that's a great term, to be able to analyze and provide utility from all of that data. But if you have, if you listen to that video or a clinician listened to it, he would be able to tease out information. Can we automate that knowledge process and not structure it, but actually gather knowledge, which is the sort of concept behind Watson that says I'm not essentially structuring that data. So I think you're right on, and I push back on Chuck just because I think that's an interesting discussion and it's helpful to understand the technology. I know he's a big proponent, and it's fun and interesting to hear about that so that I can learn and other people can learn. But I'm not saying it's not. I think we're a little bit early. He's paddling. He's seen the wave a long way back, and he's already paddling. We're maybe just catching and turning around and looking to say, oh yeah, I can see that coming.
I think many doctors are watching and paddling and saying, do I want to do that? So, do I want to get wet? Go ahead, Colin.
Yeah, no, I was just going to say, I mean, that's such an interesting concept that you wrote about, and Dr. Nick, that you're talking about. When we get to the day when we can track all this health information in an unstructured way, I think then, tools like this one that we're using right now, the chatting and the video, will definitely be a way that we're going to go forward. Because I think this is a more natural way to interact. Like, why are we spending all these hours after the visit, during the visit, documenting things into discrete fields? I think as the computers get more powerful, as the technologies like Watson get more sophisticated, I think those will emerge. I will say this, I mean, what Dr. Nick said is very correct. Just in relation to social media, I think the reason maybe we haven't seen the uptake of the new tools and even the older Twitter and LinkedIn is because there wasn't a clear ROI, which unfortunately is a horrible thing to say because people just should be involved. But I think the doctors just didn't see, and a lot of people in healthcare just didn't see the value of participating. I think it's only been with these tools maturing a bit and the audiences being there, and now the several peers getting involved where people can say, okay, well, there may not be a hard dollar value ROI, but in terms of investing my time, it's now worth it. Now I might jump in. And so I think we're sort of beyond the early adopter phase now in some of these social media technologies, but I think now we're getting into the phase where people actually who have been involved for some time are seeing value and can get other people to jump on board. It's not as proactive as it used to be. I don't think anyone's clamoring to get more doctors on Twitter anymore, but I think just because it's matured, I think more people will join it once they see that there is some intrinsic value to participating.
So I want to jump in quickly, John, if I may, because I want to shout out to that paper that just came out from Leonard Kish and Eric Topol that was in Nature. And if you haven't read that, I think that's just a fantastic piece that talks specifically to this whole patient security, control of data. They make an extraordinarily great case. No surprise when you combine those two folks. It's a bit like plutonium. Separately interesting, together, wow, what an amazing effect. The ownership of that data belongs to the patient. A model that essentially based on Bitcoin, which I think I've seen a lot of this now applying in healthcare. Fascinating insights. Helps potentially solve this challenge, and that can be then it doesn't matter the social media, the video, whatever, that ownership and then the sharing, but the general utility shared, but also more importantly, I want personal utility from sharing that information.
So let's finish this off. We have like 2 minutes left. Let's go around the horn. We'll start with Chuck, but let's finish off with, where will patient engagement, what will patient engagement look like 10 years from now? Give us your big picture vision 10 years from now. You could go 20 if you prefer. Where's it all headed?
Well, we'll have really, really cool technology, virtual reality, augmented, remote, social media, but we will be talking about the same issues that we're talking about today.
Interesting. Colin? Go ahead, Colin.
Oh, sorry about that. I was still on mute. I think unfortunately, I agree with Chuck. I think that we're going to be still talking about the same issues around HIPAA, around technology, around lack of adoption 5 years from now. I do think one of the things that I'm hoping for is that with the rise of telemedicine and with more and more resources, trusted resources coming online, that at least patients will be able to join the conversation in a more meaningful way amongst themselves. I just think we still have a much longer way to go in terms of getting patients fully involved with the healthcare organizations. So I think engagement will still be at the sort of basic fundamental level that will still be there.
So pro-consumer engagement, but not as optimistic on the enterprise side, I guess you could say.
Exactly right. Exactly right.
Excellent. Dr. Nick?
So I would say that everybody is tuned to the same radio station, WIFM, What's in It for Me. And I think the drive of the consumer to be responsible for their own costs and their care is going to be a phenomenal tipping point for this aspect of the industry and patient engagement. And I'm much more optimistic than my two colleagues. I firmly believe that we will see this just explode, because as soon as you're responsible and you see this stuff, you go, oh, that's not right. I'm not doing this for my car, my bank, we're going to get this fixed. And I think that's going to be a big driver to actually stop this conversation and get us to make that shift happen.
So I'd say the right answer is we'll be talking about a lot of the same situations. No, that's the exciting thing. I think, the exciting thing is technology can really help us in this area. And, I think it's immature today, but 10 years from now, I think it will be much more mature, and it's going to change everything that we do. Just Chuck finishes it off with workflow in the middle. We're going to have these amazing workflows that aren't going to feel like workflows. It's just going to be a natural thing that happens. Thanks so much, everyone, for joining. I appreciate each of you participating. It was a great discussion, and thanks so much to Manuel and John Bennett for organizing the online conference. Glad to be participants.